my name is Dr. Chaudry. I'm a primary care physician and clinical director of North CLACTON Medical Group. While we are staying at home, I would like to remind you all about a condition called deep vein thrombosis, commonly known as DVT. So what is DVT? DVT is formation of a blood clot in the deep veins of our extremities. It usually happens in our legs, but can rarely happen in our arms. To understand the reason why I chose this topic today, it is important to know how blood circulation works in our body. Blood is pumped by the heart into a network of blood vessels called arteries. Due to this active pump action of our heart, blood reaches to the most distant parts of our body, to the tip of our fingers and tip of our toes. The blood is then returned back to the heart for recirculation by another network of vessels called veins. The blood flows from small veins, usually visible through the skin, called superficial veins, into a network of larger veins which run deeper through the muscles of our extremities. And hence, these veins are called deep veins. There is no active pump to push the blood back into circulation. However, when the muscles in our legs and arms work to help body movements, they facilitate return of our blood by squeeze and push activity on our deep veins. Understandably, with reduced activity and less mobility of muscles of our limbs, the blood can stagnate in the deep veins and can cause clots to form. It is important to know at this stage that small clots are routinely formed in the veins and are swiftly dealt with by our inbuilt defense mechanism. The larger clots, as long as remain stable in the limbs, may not be of any danger apart from causing localized symptoms, which include pain, swelling of the limbs, redness, and tenderness of the area. However, the clot can become life-threatening if they dislodge and carry to other parts of our body, such as to the lungs. To remind who is at risk, anyone can get DVT, but as I explained earlier, the main contributory risk factor is lack of mobility and inactivity for prolonged time, for example, when sitting or standing too long. The risk is further increased by being overweight, by smoking, and in those who had DVT in the past. Some other contributory risk factors include damaged veins, injury or fracture to the limbs, pregnancy, contraceptive pills, and some medical conditions also contribute, such as polycythemia and cancer. Your doctor or other clinicians can diagnose DVT from your history and symptoms and can further endorse this suspicion by doing a simple blood test, which can be done locally at your doctor's surgery. An ultrasound scan of the veins to locate the clot and evaluate its progression and effect of treatment over time may also be suggested. DVT is a treatable condition. Your physicians prescribe a blood thinning medication which thins the blood and prevents the clot formation and dissolves the existing clots. The length of treatment may vary according to the physician and your other conditions. So what message I'm trying to convey today is, while everyone is staying at home, it is vital to remain active within your comfort levels. If you are sitting for prolonged times, keep moving your legs and feet, even on the spot, so the legs muscles keep the blood flow through the deep veins. Stay at home, stay safe, and stay active.